Hello, Kate. I'm Rachel from Physical Therapy, and we're going to review the exercises that we're going to do post-operatively after you have a thoracotomy incision or an incision on both sides of your chest, which is called a clamshell incision. The first one, very gently, is just lifting your shoulders up, like you're shrugging your shoulders up towards your ears. Very nice. And then slowly relax them back down. And then we want to add a nice, slow, deep breath with this. So you want to try to breathe in through the nose as you lift your shoulders up and blow out as you lower your shoulders. Very nice. The next one are called shoulder circles. We're going to start off with the shoulder shrug, and then you just roll back, down, and around. Up, back, down, and around. And making sure that you're breathing through the exercise. Good job. This one usually just feels really good. It loosens up a lot of the tension in the back of the shoulders by the shoulder blades. Okay. The next one is called the trunk twist. So the picture is going to look like this, where you turn and look behind you. After surgery, it's okay to start with just the head and the neck, starting with your eyes, follow with your head, turn as far as you can. And if you feel a stretch, that's a good starting point. Okay, if you don't feel very much, then you can add the shoulders and then the trunk. It's kind of like in a sequence. Very nice. And then pause in the center. We tend to do these too fast, and we tend to go side to side, and then we start to use momentum, and we start to hold our breath. So very important to breathe through the exercise. Perfect. They do not have to be equal. So if you treat them individually, so if you feel pretty good with one side, you want to make sure you pause so you don't use momentum and swing through to a potentially more painful side. Side bending is next. Very similarly, we want to do one side at a time. So depending on the chair you're sitting in, you want to, the picture in the handout is going to show you arms down by the side. So sitting straight up, straight ahead, keeping your vision straight forward. You want to drop your ear down towards your shoulder, starting with the neck. If you're doing okay, then you can add the shoulders and the trunk and try to breathe through it. Good job. And then back up to the center and pause before you try the other side. Ear toward the shoulder, nice and easy. Adding the trunk up to tolerance. Very good. And again, they do not have to be equal. So only as far as you can on each side. Okay. The next one is just, it's called a chest stretch. Try to bring your hands up behind your head. All right. And then we're going to start with slow, deep breaths. Breathing in through the nose, out through the mouth. The old expression is smell the roses, blow out the candles. Good job. If you're doing okay, then we can add little butterfly wings. And then breathing in as you open up and blow out as you come back to the center. And breathing in and out. Good job. And relax. Okay. The next one is just a single arm raise. Just raising one arm up as you breathe in and blow out as you lower. And you can alternate sides if you want. Very nice. Try that one more time. You can, very nice. Get a nice stretch there. Nice deep breath. You can add both arms together as tolerated. But not if it causes pain or a lot of pressure in your chest. Okay?
Okay.
So far, so good? All right. The next one is called out, up, and over. I'm going to bring the arm out to the side. Yep, just straight out to the side, up and over the head. And back out to the side. Very nice. And then you can add a deep breath, breathing in and blowing out. So the method to the madness is we want to do these just to help with pain control, because if we don't move, we get stiff and tight, and that tension, that stiffness and tightness pain is actually more painful than the surgical pain. On the handout, it's going to tell you to do each of these exercises 10 times each, twice a day. That's kind of the end goal. Initially, right after surgery, it's going to be more helpful to spread them out across the day. So the number of repetitions is going to depend on how you tolerate them. So you might do, 2 or 3 initially, and then build up to a count of 10.